have one question with 6 parts. At your other 8 locations, how many beds are being eliminated? And for the addendum, which was just provided to us the day before Thanksgiving, I'm wondering, your chart indicated that there would be stroke service available for some period of time, but basically, when you leave, there's no stroke service or heart attack service south of 30th Street. So I'm wondering, emergency room, have you discussed the elimination of your emergency department and the impact on other emergency rooms which are already crowded?
And you eliminated your wonderful ER training program there a couple of years ago. So you were planning this for a while.
Ma'am, we're going to give everybody a chance to
That wasn't a question. That was
we'll
a
let you
statement.
make a statement as well.
So on the beds for the system,
I think we'll get back to you with that. I mean, honestly, but the beds fluctuate all the time. How many beds that we staff across the system, so those beds do constantly fluctuate.
But with your 20 to 28% usage now, that's roughly what number of beds will not be available at all. It sounds like that could be 150 people in the community will have to go elsewhere.
Correct me, Liz, if I'm wrong, but currently our average daily census for medical beds at Israel is about 100, correct? And that continues to go down. When we filed the closure plan, it was about 140.
Well, you closed services, so obviously those beds are no longer utilized. So I'm wondering, everybody knows that you need to have a family close to home, close to you, to be in the hospital with you, because the nurses are overburdened. Now people from downtown are going to have to go to your closest inpatient location, either at 59th Street on the west side or up to 95th Street. And that's a schlep for a lot of people, particularly people with few resources. So that's for people that have
And then your second question, I think, was, are we talking to the other hospitals about the volume? The answer is we're beginning that process. We're actually meeting with Bellevue on Friday, and we'll be meeting with NYU, with Northwell, NYP. I think that's it. But we're in the process of doing that, but our first meeting is this Friday.
Assemblymember Epstein or Councilmember Rivera, you guys walked in at the same time, so whichever.
I was here first.
Okay. Councilmember Rivera.
The only reason I wasn't down here and I was up there is because there aren't many seats. And I just want to add that there are a few seats here that say reserved. And as nice as it is to have a reserved seat, I would rather stand and give someone else a chance to sit down. So can we pull these few little flyers and let people who are standing up there come sit down if they'd like?
Anybody who wants to come down, please come down and sit
It's
down.
intimidating to see reserved flyers, you know what I mean? So maybe I'm projecting. I'm also going to project the feelings that I have about this, and quite frankly, I feel many of us feel devastated.
Yeah. Thank you.
We've actually experienced a slow reduction. I know this is a statement preceding a question, but we've actually experienced a slow reduction of services and the movement of services to Uptown and the West Side over the last few years. And so we have felt that when the plan changed from 2021 that there was hope to keep a hospital. Because now, with the closure of this one, there will only be one stop at 23rd Street. And anyone knows the closer you are to the hospital, just the better you feel. And if you are disabled, if you are sick, if you have a chronic condition, it is really important. So I guess my question to you is, we were at a meeting, we received the same information that you received today. Nothing more, nothing less. And what you did say, though, was that you did not qualify for funding as a safety net hospital. However, you hadn't really lobbied the state or really taken any steps to try to become a safety net hospital. And I wonder whether or not you would reconsider that in working with state electeds here who have expressed explicitly that they would support you throughout that process in order to keep these doors open.
Just to clarify one thing on that, we've actually spent the last year and a half, almost 2 years, working with the state, trying to be designated as a safety net hospital. The rules are very complex. It's based on the percentage of Medicaid patients that you treat, both on an inpatient and an outpatient basis. The Beth Israel Medical Center does not qualify, in particular on the outpatient side. So that's why we were not designated as a safety net hospital. So we have worked very, very diligently on that. Liz, did you want to add?
No, thank you.
Councilmember Epstein.
So, in all due respect to the non-answer to the councilwoman's question, for the last year and a half, Brad, you've been talking to the state. You never spoke to me. I'm a state representative. You never spoke to the Congress member who was at our meeting just a few weeks ago and said we want to help. You haven't spoken to the 3 senators who are involved, who even advocate for you with the governor's office. So I think the councilwoman's question needs to be answered about whether you're going to work with the state representatives to get to the governor's office to get the designation to want to be a safety net hospital, because we need that. And then I want to also then, my daughter was born in this hospital. My daughter is born here. And so this is not only just personal to the council member and the assembly member, and to the people who are all here, right? Personal to me. We talked about how this community relies on this facility, and honestly, the lack of transparency here is really troubling. And the lack of communication is really disturbing because we care about this neighborhood. We care that there's no hospital going to be below 23rd Street. So you do a public forum without checking with anybody here. You didn't check the elected. CB3's meeting tonight. There's lots of people who want to be in our community who are going to that meeting. I don't see language translation. I didn't see flyers in any other language than English. I appreciate the sign language interpreter, but we have Mandarin speakers, we have Spanish speakers, we have lots of languages in our community. I don't see headsets. I didn't see any flyers outside. But again, I was in the hospital this weekend. Unfortunately, by this one, there was no flyer inside the building to let people know that there was this meeting tonight. So I appreciate that this is your plan. I don't like the plan, and I think it's a problem for our community. And so we're going to want to work with you to keep this open, and we hopefully will have willing partners. The most concerning part you mentioned about the urgent care. Is your urgent care facility going to take anyone who walks in the door, people who are on Medicaid, people who are uninsured? Because there are lots of low-income people in our community. When this facility closed, they have no other option. And so what is your commitment to this community, especially to the lower income folks who are here, to be able to be accessible, be available? Because my understanding of urgent care versus an ED, an emergency department, you are required to take everyone who walks in the door. But as an urgent care facility, I think those rules are slightly different.
Specific to the urgent care today, we do take all patients regardless of their ability to pay or how they pay. And we are, sorry?
It depends on what site it is.
Oh, we're speaking about the Union Square site. It's the urgent care downtown. And again, open 7 days a week and take care of all patients. And
Not 24 hours. And there's
it's not 24 hours, but it is 7 days a week with 12 hours a day, Monday through Friday, and then 8 hours on
Councilmember Bowers? Rob, you're on deck.
Thank you. look, I won't speak for everyone in this room, and I'll speak for myself as somebody who lives across the street. We are opposed to the plan. We want the hospital to stay open. And it's rare, actually. I've talked about it. People don't want to expand and open, and we want, and it's rare, I think, if you have a community standing up and saying, we want to help and we want you to stay open. And for folks that work there, live nearby, have had family members in there, or birds there, you guys are important. Been an important part of the community for a long time, my entire life. And for the folks in this community, I think many have also relied or worked there. And so I just want to restate my opposition and everyone here's opposition to the plan going forward. We want to work to keep something open. We understand that healthcare is changing, but I think we want to talk about a way to keep you guys open in the most, and that's at least in emergency services and the most important care as we talk about how healthcare is changing. But I have 3 questions. I want to say that first because recognizing where you guys are at and where we're at, and we're getting a difference of opinion. What is the long-term plan if you do close down for the property there? I represent Stuyvesant Town, Councilor Rivera represents the hospital, but many of my folks have been asking that question, which is what happens? Who is going to take ownership over that? What is the plan to get rid of that property? Are you going to continue to open and do something else with it? So that's question number 1. Number 2 is when I walked in, you had something about unionized staff and how you're going to deal with that. My question would be, what about non-unionized staff and what's going to happen to them? And then third is, I think we have a non-unionized staff member here. And then my third question is, building on what Assemblymember Epstein and Councilor Rivera asked, which is about the designation of the state funding. I guess the question is, if you got designated, would you stay open? Is that funding stream the thing that is causing you to close, or is it a larger picture around your financials? So if the state elected officials did want to engage on an effort to try to help you find that funding or get that designation, would you stay open? Because I think that is a really important question that we need to know, and that's where I think the origin of their question is coming from.
Thank you so much for that. So let me make sure that I have the first one, NBU staff, which is the non-union staff. We are working with all of our non-union staff for other opportunities in the organization. So although it's not a guarantee, we are working diligently to help our non-union staff at the campus. To answer, I think it's a 2-part question, is the future, and then can we stay open? I think our biggest challenge right now is the financial situation across the organization. And it's highly unlikely that we'll be able to fund the kinds of deficits at the campus, and the campus is simply too large for what we need to accomplish in that campus. As far as the future, this is where we really will like the help of the community, is to really think about a plan for the future and how we can do that. Unfortunately, that future is years away from when we have to deal with our financial reality. So it's not an immediate fix.
I guess the question is, do you have a plan to get rid of the property, sell it off, or keep it on?
There's nothing.
It's really too soon.
It's not.
Right now.
They already sold it.
This table here,
They already got the
right
money
now,
sold.
we are focused on closing this hospital safely and with the best quality that we possibly can, as we always have. It's too soon to really talk about what kind of individual interest in
Ma'am, first of all, we can't hear you because you don't have a mic. Secondly, is we will let you make a comment. We have an order that we're trying to accomplish. We will give you the right to speak. As soon as we get, we will get you a microphone when we get to the process, and we'll get you able to make your statement or question. Rob.
Thank you very much. I'm Rob Gottheim. I'm here on behalf of Congressman Nadler, who is in Washington and couldn't be here. A couple of points, or questions to the points. The elected officials, which got the same presentation that you got here tonight, nothing more. We asked, you go back, think about how we can keep the hospital open. What about the state designation of and we haven't heard that. We still haven't heard that here tonight. So where are we on that? There's really dishonesty here in that you did not engage with any of these elected officials. You said you were having a discussion with the State Department of Health for, I think Greg said, what, a year and a half? None of us knew that. And so here we found out 2 weeks ago that you want to close it down. And not only are you closing it down, but you're shutting, it's a self-fulfilling prophecy. You're shutting down services and making the hospital not sustainable. So, you do not appear to want to work with any of the elected officials here because you scheduled a meeting without us. You haven't gotten back to us. So, what's the status of working with us and going to the governor's office and the State Department of Health to try to save this? Because all of us want to try to save it. That was the first part of the questions. Two other parts I had was, you mentioned the standing ED that we were going to do at Pioneer, but all you mentioned is economics have changed. You really haven't flushed that out of what happened there. So I think we all deserve a much better explanation of that, and about the property, because a lot of us see that this is almost like a real estate grant, because we're not talking anything about what we can do with that. We know that property has a lot of value. Now, maybe I understand you can't answer that, but the board of Mount Sinai, which now there's one board, not Beth Israel, it was combined. It's almost like they see dollars and that's going to help. So the entire merger here seemed like when you bought Continuum and you took over these 10 years ago, you're saying it's not sustainable. The question is, was it ever sustainable? And downtown community here, we lost St. Vincent's. Now we're going to lose Beth Israel. Cabrini. And Cabrini. So I mean, it's a bad situation. So first question is, what's the status of working with the elected officials in the community to try to save us? And with that, do you want to do that? You need to explain more about what you're doing with that property and why the ED is not a viable option like we have at the old St. Vincent's property.
I think the unfortunate reality, again, of our finances is forcing us to make a decision in a silo without that new plan executed, right? Without coming up with that new plan. We really wanted to focus tonight on the closure because we do have to, unfortunately, go forward with that. And if I can just finish, can I just finish? I came to Beth Israel 10 years ago. 10 years ago, Beth Israel was losing $100 million.
How much
we were trying to rebuild Beth Israel in the beginning. Please, I'm trying to tell the story. And we spent a great deal of time trying to add services to the building prior to realizing that the campus was too large and we continued to lose significant dollars year over year. And it hasn't improved, and we've continued to try to do that, and unfortunately we are unable to improve the bottom line of that campus.
I think the other thing to add there, Rob, you mentioned, part of the reason for the building is the increase in costs, and Liz, correct me if I'm wrong here, but since COVID, costs for building have escalated over 30%. On top of that, we have the additional labor costs and supply costs. And the reality is that reimbursement, whether it's through Medicaid and Medicare or even the private insurers, hasn't risen at the same level. So when we proposed back in 2017 to build a new hospital, I believe it was a $600 or $650 million project. If we were to try to do that today, it would be over $1 billion. That's the problem that we face. That's the reality that we struggle with. And we spent the last 4 years again trying to reevaluate all those options.
We face the same inflationary issues that a lot of you in the audience do. The only problem is that we can't raise our costs. We can't raise our prices. We get from the government what they give us, and we get from the insurers what we negotiate. We don't have that ability, so we are hamstrung somewhat more like in this industry than other places.
More than $1 million in salary sitting up there. Like, what are we talking about? Like, are you kidding me?
Can't hear you.
I asked the question, 2 weeks ago, the elected officials first heard about this plan. We asked the esteemed people on the stage here, can we go to the State Department of Health and to the governor's office to try to get this designated a, what is it, safety net hospital? You said you would think about it. We haven't heard 2 weeks later. What's the status of that?
What's the answer?
Full-fledged closure.
Thank you.
That's what they're doing.
Yeah, so, again, unfortunately, even with safety net funding, which would take a long time to try to determine if we could get that, again, a year and a half, and we gotta know, even with that funding at this point, the costs and the losses are insurmountable. So it won't be enough to help us stay open at this point. So that's the answer. The second part to that is we would like your help as we move forward with looking for another financially viable plan, and we will be reaching out to you.
Cat here.
Again, right now, we're hyper-focused on what's happening at Beth Israel and really making sure that's a smooth and safe transition. So we have to get through this crisis.
Correct.
Right.
Let the people talk.
That's the honest answer.
For President Levine?
Thank you, and I will be brief because I want to hear from all of you. There are 400,000 people who live in Manhattan south of 23rd Street. On a busy work day, a few 100,000 more who come to work here and tourist, etc. This is a very densely populated part of the city. We have been hemorrhaging hospital capacity here for decades in Lower Manhattan. Most painfully, the loss of St. Vincent, and we're down to 2 full-service hospitals. We have Presby downtown. Yes, we have a standalone emergency department run by Northwell now. For a lot of reasons, it's just not the same. An emergency department which does not have beds to admit people to, which does not have operating rooms, which does not have an ICU, cannot handle more intensive medical emergencies. I know you know that. There's something special about an emergency department with the hospital at the same site. An FDNY ambulance is not going to drop someone in cardiac arrest at a standalone emergency department because they won't get the care they need at that type of facility. This hospital, Beth Israel, is also notable in the way it serves low-income people downtown, and there are so many. For people who live in NYCHA developments, this really is a critical hospital. For people who are on Medicaid and Medicare, this is a critical hospital, more than some of the other hospitals in the area, to your credit. And I understand that Medicaid does not adequately reimburse for your costs, and that's something that I think all of us are willing to help fight to fix. But in the meantime, the loss of this hospital for people who have nowhere else to turn leaves a huge void. And NYU, that emergency department, already at capacity. People are going to default to Bellevue, especially people who are on public insurance or uninsured. And Bellevue's already overwhelmed, and our public hospitals are already overwhelmed and underfunded. And so to put this capacity there is not a solution. There's just no substitute for a standalone hospital, a community hospital, with an emergency department, with an ICU, with a diversity of specialties on site. This would be a major, major loss for downtown. So I personally join with all my colleagues up here. I'll do anything I can to help you find new sources of money from Albany, Let's solve this problem for the benefit of downtown. Thank you.
Councilmember Bottcher. When are y'all gonna let the public talk?
Hi everyone, Eric Bottcher. I'm the West Side council member, but this affects all of us downtown. Little bit of Groundhog Day going on here because we went through this a few years back when you had announced the closure. When the pandemic came, I was sure that meant that this wouldn't happen again, because during the pandemic, we saw how badly we needed physical square footage, the physical space, and we needed it badly, and I was sure that would mean that all the parties involved would come up with a way to prevent this from happening, but here we are. Another reason why I'm really disturbed about this is the closure of the psychiatric services. We are experiencing a severe mental health crisis. I know this isn't, Beth Israel isn't specialized in mental health. I know you're opening Rivington, but I would like to know what the plan is to the bed count specifics about what this means for mental health. I also want to reiterate what you heard here today. You have every elected official who represents this area united, saying we're here to help you prevent this from happening, as well as everyone in this room.
So thank you for the question. I did want to mention, we had a slide. Sorry, we had a slide that we showed earlier, just indicating that the new behavioral health center is open, and it's been open since July. And we just finished the move into that center of our inpatient units about 2 weeks ago. And at this point, we have added many new services in that building that did not actually exist on the current Mount Sinai Beth Israel campus. I don't see it up here, but, oh, thank you. There we go. There we go. So every service with a red asterisk is an indicator of a service that is either brand new, that didn't exist at Beth Israel, or is expanded in size compared to the current Beth Israel campus.
Eric, specifically, I think your question was, it's 115 beds, correct, at Rivington, Dr. Mitchell?
It's 72 psychiatric beds, including the extended observation beds, and we have 51 detox and rehab beds.
I think it's 115, and then we got the 20 PHP slots and 8 crisis and respite.
Correct.
So those are new services, but it's 100.
They moved.
We moved those beds to Rivington.
You got moved to Rivington?
Everything's at Rivington.
Everything's at Rivington.
Thank you. I think we've all had the opportunity. State Senator Brian Kavanaugh. I'm not going to follow Jeopardy rules and phrase this in the form of a question, but just to say, I know you've heard from most of the officials here. You'll hear lots of questions and I think more importantly concerns about the plan tonight. And we'll have other forums to discuss those too. But just to say, the state health department has oversight, has jurisdiction over this, has to approve some of these steps. We will be in touch separately with them and jointly with you, but we are just standing united in making sure that the services, the critical health services, you all are healthcare professionals, you understand how critical these services are, but a plan that has this rapid a time frame, plan that plans to close down critical services by next July, in some cases without new services to take the place, really are not acceptable to this community, and we've had opportunity to talk about ways to improve the financing and improve the conditions, possibly with some state assistance. But I just wanted to publicly express my concern about what's being proposed, and I'll turn the mic back over to others and continue to listen. Thank you.
Dawn, do you want to ask a question?
Are you going to let the public talk?
Yes.
When? It is 7:04.
We started late. We're going to be able to stay a little later. So
Okay, I don't want to hear a hard stop at 8.
It's not going to be a hard stop at 8.
Okay. I'm a little concerned. The room size, this is a concern.
Thank you. I'll be brief. My name is Gonzalez.
Can't hear. Take your mask off.
I'm here representing Senator.
Can't hear.
Thank you. I'd like to ask.
That's her option.
What services are being offered at Mount Sinai Beth Israel at this time, including inpatient, outpatient, and other medical services? I wanted to add as well, I know that you're in the process of having meetings with other hospitals, but what is the plan to address any gaps in services? Whether that's services that are not offered at other hospitals downtown or that are not accessible to current patients. Thank you. Senator Kruger.
Senator Liz Kruger.
So, I'm trying to, I didn't come prepared to talk about all the different services. It's primarily the emergency department and med surge at this point, right, in the hospital.
Right, at the 16th Street
At
campus.
the 16th Street campus. Right.
Medical beds.
Medical beds, surgical beds, and an emergency department.
But at the same time, we've been enhancing outpatient care.
Right, and at the same time, across downtown, we have 30 specialties of physicians and care across our downtown enterprise, which is very robust and very significant.
Are there any other representatives of any elected officials that we've missed?
Can I please ask you to address the second question?
Oh, sorry, so sorry. So gaps in services, I'm sorry. So the gaps in services, again, where we have multiple clinical work groups working right now on what additional services we would stay downtown versus go to other sites. So I don't have a full answer.
Also, if today or in the future somebody were to come and either need a service and they walk in the door that's not available, or develop a condition for which they need a service, we have a very, very robust clinical command center that is able to move patients to the site within our system to best care for that patient. We ensure a proper
11
handoff,
hours.
and we use all the same medical records. So we have, unfortunately, with COVID and other things, we have a very robust experience with safely moving patients to the right place at the right time.
We're now, hold on. Okay. Raise your hands. Let me just get an idea of who wants to.
Yeah, me.
Okay. So this gentleman in the middle there actually approached me before, so Chris, give him the mic.
Thank you. I have really one question, and that is, we've seen a lot of numbers.
We can't hear you.
Can you identify yourself, sir? Sorry, identify who you are and also speak into the mic.
Is that better? Yes. Thank you. By the way, my name is Richard Turin. I'm a 50-year resident of this neighborhood, and I'm a patient at Beth Israel downtown on 16th Street. I see that you spent a lot of money on this. Sorry. You spent a lot of money on this presentation. And I think I'm probably looking at $2 million a year in salary. Addressing us. But my only actual question is, how much have you paid law firms to help you get away with this?
Go ahead.
Okay, right, I understand that.
Sir, go ahead, stand up and...
Who, me?
Oh. Thank you for giving me the floor. My name is Bottcher. I'm the Housing and Health Community Organizer at the Center for the Independence of the Disabled, mostly known as
Slower, so we can understand you.
A little slower and louder, sir, if possible.
Thank you.
Take your time.
Again, my name is Bottcher. I'm the Housing and Health Community Organizer at the Center for the Independence of the Disabled, mostly known as CIP. And this is a public forum, I believe, and not a civil service forum. And I'm happy that people are here to fight to keep this open, but so deceived to see that other people are not trying to make the work that is required in order to keep this hospital open. It's sad and frustration, sadness, and everything coming together. And people are still not getting the chance in order to speak up and say what they believe was supposed to be right. Elected officials are not our boss. They are here to serve the community. So give the community the opportunity to express themselves. I will go straight to the point. You guys said that we have a financial problem, and you said that there is 150 million of loss. But you guys did not mention how much money you guys are receiving from the state and the federal funding. I believe you guys receive 500 million every year from the NY budget. And I believe that from the immigrant care pool, you guys receive half of $1 billion. That's a total of $1 billion. That's a total of $1 billion. It's half of $1 billion from the immigrant care pool and another half of $1 billion from the New York government office, right? So you guys are receiving sufficient money in order to keep this hospital open, in addition to the medical bill. I was also expecting to know how many people will be transferred into each facility that you guys are planning. But you cannot even give a number of beds that is required every month or every year in order to help people feel healthy. And we know that New York is a melting pot. This city, everybody is coming, immigrants are coming. And so then these numbers are going up and up every year. We expect you to give us clear clarification before having the autonomy to close this hospital in front of the DOA. Thank you so much.
Chris, look at the woman on the back row who was standing up earlier.
Oh, he looks so frustrated. That's so cute. And we should.
From the New York Times, we hear that you're going to merge with a hospital on 2nd Avenue. But that building is already going to be sold. It is going to be sold. It is a done deal. So we will think that New York Eye and Ear Hospital will move to Beth Israel on 16th Street. So there is nothing left for the community except the Eye and Ear Hospital, because the building of the Eye and Ear Hospital on 2nd Avenue, the old building has already been sold, and it will become sold to the developers, to greedy developers who will build apartments. So, as I said, you already sold the nurses' residence on 1st Avenue in front of Chipotle and Starbucks to the new school, and the students are there. So what is going to happen to the affordable housing that we so badly need? Please answer.
So I just want to respond to one thing. I think you said the 2nd Avenue building, meaning New York Eye and Ear. Did you say it was sold?
That's what we've been told. So
No,
tell
New
us
York Eye and
something
Ear was
different.
not sold. No.
Nothing in New York Eye and Ear
Has been sold.
Yeah, no. That didn't happen.
We've been joined by Senator Gonzalez.
Hi, everyone.
Thank you.
Hi, nice to see all of you. This is about all of your input, so I'll keep it very brief. My name is Senator Gonzalez. I cover this part of Manhattan on the east side, as well as parts of Queens and Brooklyn. And I'm here because I'm also deeply concerned about this plan and closure. So I'm really excited to hear from all of you today. Thank you all for volunteering and taking your time to be part of this collective process. It's necessary to also engage your neighbors. I'm also here with an ask for all of you. But in Albany this year, we spent a lot of time talking about expanding healthcare access and the real need in New York City. And so this has, been alarming to us as electeds as well, but alarming for our district, of course, which absolutely needs all of the resources it can get. So just here in solidarity with all of you expressing your interest, but my office is always here to answer questions. If you have additional comments after this, we're right on 42nd and 2nd Avenue. So thank you all so much, and I'll turn it back to our office.
We have one more elected official.
Really? No,
Senator
no,
Baldwin's
stop.
office.
Stop.
We're fine.
Hi, I'm Marina. I'm here on behalf of Congressman Goldman's office. While I was not born and raised in
this part of the neighborhood, but I do deeply understand every constituent and the concern for the closing of this hospital, and I'm always here to show support, at least for having the services be available to neighborhoods. So thank you very much for everyone for bearing up with me.
Chris over here in the one row down.
The green one.
I'll tell you what, you three just.
There you go. Thank you.
Yeah, thank you.
Put our hand down.
You can then hand her the mic and you go.
All right, cool. Thank you.
So I want to be brief, but I want to talk to the people.
Can you please
my name is Nancy, and I want to talk to the people because this is being done in a silo. But the city has shut down 53 hospitals in the past 25 years. 53 just in New York City. 20 public hospitals. So it's insincere for these elected officials to act as though this is a surprise or something new. This has been going on over and over again, and we're pretending. We're holding these people responsible, but in actuality, it's us. We are responsible. It is when you look at the organizational chart of the city of New York, the person on the top of it is not the mayor. It's the people of the city of New York. If we want to keep our hospitals, then we need to put the fire underneath our elected officials and make sure that they know what we want. We need to be the ones to present our issues to our elected officials. We are the ones who have to pay attention. We are listening to the news where they tell us it's the homeless pushing people. The homeless are women and children in this city. And the people that are being pushed on the subway are severely mentally ill people with nowhere to go. It is 53 and 20 public city hospitals have been shut down. And all of them, except for 1%, have all gone to luxury housing. This is greed, okay? This is greed. Thank you. This is no shock, no surprise.
So my name is Jennifer Rodriguez. I am one of the 1199 reps. I'm accompanied here by my colleagues. We cover Beth Israel. We have been meeting weekly with management. I want to see by a show of hands, how many people of you work in BI? Because I'm a little concerned. How many of you, put your hands down now. How many of you got the flyer from management, or was it posted anywhere about today's forum? Raise your hand, please. Because I'm a bit concerned about the size of this location when we service 400,000 people in this neighborhood and over 1,000 employees will be affected who asked you continuously if you spoke to the elected officials to save their home. The answer was yes. Yet I'm sitting here listening to every official said that you did not reach out to them. We had a meeting. The reps were not informed about this public forum. Our other side had to investigate it and send us the flyer. So if you want to hear, why isn't most of your staff here to speak about the patient safety concerns, to speak about the short staffing, to speak about as you are sending out outpatient services uptown, you are left with a skeletal crew that is being asked to change their shift to cover their night shift. So you're going to have those people leaving soon, so you're not going to make it to July.
No.
I'm a bit concerned because this was not publicized at BI. I'm a bit concerned because we sit every Thursday and have a meeting, the reps, with the delegates, and this was not shared with us. Why? That doesn't make any sense. It's actually infuriating. So when I go back tomorrow to BI to talk to the workers and let them know that you did not speak to none of the officials like you guys said, this is going to be a bigger problem. This is unacceptable.
And we're left to deal with it.
We absolutely not. If you talk about you did not get approved because you don't have the outpatient volume, for the last 3 years you've been moving outpatient services everywhere. So you weren't preparing for this. I don't want to hear that. Every week our members are sitting there. You're talking about we don't have no money. Then why are you sending our services out? Why are we not spending the money for beautiful Rivington promotion like we are for BI to promote people to come? I don't know. I'm very concerned because I thought you guys were being transparent. So to sit here and listen to this is very disheartening. And I feel bad for the community and the rest of your employees that were trying to be loyal to you and stay to the closure when clearly everything has not been put on the table. And I'm going to make sure to mobilize.
Hello, everybody. Same on? Yeah, it is pathetic. Hey, my name.
Sorry. The room size? Why did you choose this small room? A lot of people were outside, got turned away. I got turned away. Are you kidding me? You purposely chose something. What is the room capacity here?
175.
Okay, then you service 400,000 people and 2,000 employees are being affected. Why do we have a 200 room capacity? That doesn't make any sense. You kidding me? And you're taking emails at the door for the next forum? You kidding me?
Let me just say, this is a first meeting. We were trying to get out and hold the meeting as quickly as possible, and we took the room, the largest room we could find available.
Why didn't you tell the employees about this meeting? Why, Liz? I'm talking to you, Liz, because you work at BI. Why was this flyer that we received from our research department at 1199? Why was this not posted in the lounges for your employees to show up and advocate for their concerns that they are bringing every Thursday? Yes. Why? This is unacceptable. That's not transparency. Why I have to get a flyer from my research department?
So Jennifer, I know we did talk about this. We did talk about this yesterday.
But yesterday, you didn't this room
No, I don't want to go back and forth. I posted the flyer on the Zoom call and I asked about this forum. You guys did not share the information. Again, how many people here work in BI? Raise your hand. Okay, you have only 2,000 people being affected. They're not here. Their voices are not heard so that our representatives can hear them. They've been begging you to call the representatives to keep their hospital open.
For a town hall in the hospital.
What the?
Yeah, I'm speaking out. Yeah.
I'm
Hello?
Yeah.
Yeah.
Linda and Mark.
Very good. Thank you. Yeah. Hello. Good afternoon, everybody. My name is Christopher Leon Johnson. I'm not from here, but I used to be a 32-day shop steward. I used to work at a hospital before. I just want to ask all you guys on the stage a question, but shout out to all elected officials out here, including Gonzalez, who's the state senator for this district. I want to know for all you guys on the stage, how much did the developers pay you off to sell at this community? Wow. How much did they pay you? They paid all. You guys get all paid off to sell everybody out. You not only saw the community, you saw the constituents here, you saw the elected officials here, you saw out the union members here, you saw out everybody that support this hospital. You sold them all out for what? A little small paycheck. These guys gonna make $1 billion off while you guys getting paid the crumbs. But let me ask you a question: is how much your soul worth? Because you guys sold your soul for the paycheck. So that's all I gotta say. Thank you.
Not every institution needs to make money. Why don't we shut down the schools? They're not teaching our kids. Dude, schools ain't making no money. Shut down the schools.
My name is Barbara Caparelli. You have proven, this is a done deal. You have proven you do not give a damn about the health of the downtown community. As the borough president said, we are densely populated. Look across the street from the hospital. Look below 14th Street, all along the East River, and all the public housing. All our friends come here. This is personal. My kid was born here. My father has a stroke, a heart attack. He comes in, he gets service, he goes to the ICU, then he goes, intensive care, then he is going to a step-down unit to be able to breathe. This is what you need. You need a hospital where the families can come and visit. My daughter was born here. We are in a flood zone. Hello, Beth Israel. NYU and Bellevue, they went out. We were blacked out so many times. We are a terror target. This isn't, and we're not, what do you call it, a central business district? We are residential, and you need to show that you care for us. You don't care for us. You think I'm going to go have surgery at Phillips Ambulatory Care over there? Or when I need a special appointment, I'm going to go up to 86th Street? Come on. The intensive care that you talk about at 10 Union Square, there's always a wait there. The PCPs that were at 10 Union Square, they're on the floor, 11th floor now at Beth Israel. But I have watched you renovate, and I watched you discontinue that beautiful emergency program, nationally renowned program, 2 years ago. You're just hemorrhaging staff. You've been phasing it down. You're not admitting people, and we need your services here. We're not running all over the place. We want to be near our friends and family who are sick. We want those kind of services. We need them. Stop piecing us out. You're like, NYU is to real estate, Pac-Man. You do that to the whole medical system down here. Gobble, gobble, gobble. People, profit before people.
Oh, I'm pissed off. Can't wait for Thursday's meetings.
My name is Charles Nye from Community Board Fire and speaking on behalf. Now, I'm very concerned, as we know, there's a lot of congestion in the city, and I'm worried about how people are going to get to these other locations without Beth Israel being around. You know, ambulances struggle already to get through the traffic. The traffic's awful. That's why the city's trying to do congestion charging. And I'm very concerned about how the stroke specialists, the cardiology specialists, you know, are being shut down. I mean, as we know, if you're going to have a heart attack or you're going to have a stroke, you need to get to a hospital quick. It's time is at the essence. We hear those adverts on the radio about how to see the signs of having a stroke and how quick you must react. So, you know, I don't think it's going to help someone suffering from a stroke or cardiac episode to have to go further to a hospital. So, like I said, time is at the essence. That's why we need Manhattan to be covered by hospitals so that people have a quick way to get to emergency rooms. Thank you.
Time is brain.
So if people are calling with a stroke or cardiac condition and they access EMS and FDNY will work to get that patient to the place that can accept that patient and offer the services that they need. And we work with all of our other hospitals along with FDNY to take care of those patients.
You only got 3 hours. You got 90 minutes for a heart attack.
You get out of town through traffic during rush hour? Correct.
They're a private institution. Our city did not invest in our hospitals. Our city didn't do it. This is a private institution. They're losing money. We're not helping. What do you expect?
Start?
Yes.
Hi.
Go ahead.
My name is Eileen. I'm a nurse, pediatric nurse in the pediatric ED observation unit at BI, and I'm very happy to say that I'm part of a unit of very dedicated nurses, as well as adult ED nurses that come over to work with us, and we're very dedicated to our jobs. It was shown by the commendation by Liz Jacobs survey in August, and you know, what's this going to do for, you know, the kids and the families that live in this area? You know, we have a sizable community in Stuytown, East Village, Lower East Side. We even get people from the outer boroughs coming to us because, hey, they don't like Maimonides, okay? And, you know, I've had experiences in other hospitals as a patient and as a visitor. And I'd be hard pressed to, you know, to find out, to have to tell my former neighbors, yeah, you gotta drag your cookies up to NYU or Bellevue or American Presbyterian. A lot of those people have had experiences those places, and they weren't nice. That's why they always keep coming back to us. Now, it has been brought up not too long ago by some of my colleagues, to you, Ms. Selman, and to Mr. Christopher Byrne of Human Resources, about, you know, making our pediatric obs unit, maybe relocating somewhere else. If you eliminate this, you are destroying an entire service for this community, okay, instead of just relocating it. We are the only pediatric room in the system besides the main hospital uptown. We have let that be known. And it would be, it's just that also, we absorb transfers from Mount Sinai, Brooklyn, Mount Sinai, Queens, Morningside, West, whatever. So there is a real need for us to at least keep the pediatric unit going. You destroy this, you've also wrecked the entire community. Kids, especially now this season, flu, RSV season, asthma, COVID is still out and about, and we also have all those nice anaphylactic emergencies. You can't tend to that quickly, these kids run the risk of dying. What is that? Nothing has been said to us. Everything, you know, whenever we ask about it, all we get is crickets.
No,
We deserve to know.
Thank you, and it may be that during rounds, we may not have seen you when we were doing rounds, but So we did agree that we would set up a pediatric clinical work group, right? And that's what we're moving forward with to respond to some of the questions that the staff has there. So that's moving forward and seeing what kinds of solutions we can come up with. We haven't had our first work group yet, but we are setting it.
Why do you start in June?
What?
A month before you close. They all live in Westchester. They don't give a shit.
My name is Mary, and I'm a high school teacher. I live in the Chelsea area. And apologies, I could definitely project English. This is almost like deja vu, because I remember in 2016, 2017, we were already hearing about the cutbacks in maternity, we were hearing cutbacks of the beds, and I remember I participated in a Beth Israel community interview, and I'm going to say the same thing I said then. I said people are going to die, because when you have, certain medical emergencies, trauma centers, let's just say I'm on 15th Street, trauma centers are not that close like it was. You close this down, and as people saying that the walk-ins are like only, that they close at 8 or 9 o'clock, what happens if you have an emergency at 1 o'clock? And just like then and just like now, I'm not hearing any acceptable solutions. And I'm going to go back to the same thing. There will be people in the community that are going to die because they're not going to get the services that they're needed. And maybe you guys could sleep at night because you're not in this community, but I'm sure it's hell worried for my community.
Thank you.
Thank you, Ken. My name is Mike Schweinsberg, and I'm the president of the 504 Democratic Club, which is one of only 3 citywide clubs and 40 years old, the nation's first and largest, advocating for the civil rights of people with disabilities. So, thank you. Well, actually, every elected official here, I thank you for coming. We're all friends of 504. We appreciate that. But I'm also a 20-year resident of the Lower East Side, president of the 2 Block Long Block Association, vice president of Community Garden, etc. And I ache for my neighbors and my neighborhood. I looked at your presentation and all your charts and statistics, and I was reminded that the statistician is drowned in the lake that only average 10 feet. You can make whatever claims you want to in free fashion like that, and they don't. What really counts is that you have a 44% higher population of seniors with disabilities on the Lower East Side. 44% higher than anywhere else in New York City. And this is where you want to take services away from? That doesn't work. The other numbers that I talked about is what the lady was referring to briefly before, was 2016, 2017. I hope you'll be brave enough to let Arthur Schwartz speak at some point, because it was he that came to your emergency room by ambulance when he was having a heart attack, and the nurses told him, well, you're one of the last surgeries we'll do because of shutting down his unit. And then nurse, rather than concentrate on his recovery, he entertained nurse after nurse after who said, and they're shutting down the labor and delivery. They're shutting down pediatric care. They're shutting down half a dozen units. And he brought the receipts, okay? Those units were all profitable units. Together, they generated an income of $360 million a year. And you cut them, look, a little bit more history. When you took over the hospital, you promised the DOH that you were going to renovate it and make it a state-of-the-art facility, and that was why you wanted to take it over. Instead, you began dismantling it from the moment you walked in.
Absolutely.
This kind of divination approaches criminal in our view. You can't have the responsibility for all these hundreds of thousands of people and just begin to take it away without any advance notice. If Arthur hadn't gone to the hospital that day, we wouldn't have never known, right? It was only after he heard that and he started digging into your CONs and everything that he learned what you were up to. So now you're coming back saying, oh, you can't operate the hospital. Yeah, you created that condition. It didn't happen because there's a lower need for medical services. There's a higher need for medical services. And now let me take this back home to the disability team. What you're doing with our community, people with disabilities require a certain proximity to health care. And when you say, oh no, you got to go uptown, you got to go, when you began fracturing those services and making people go up hither, and yon to get the same service they got in one unit or one location, you are going to begin his boss, Dr. Sharon McClendon-Weir, is totally blind. And she talks about how when she had the light working with her, she got struck 3 times in intersections. So now, when you send people with disabilities out running from here to there to there, you're endangering them directly. The kind of services they require are multiple. So, in a hospital, they can go around the hospital and get the services. Now you want them to go all over town. That doesn't work. So, here's my question. Rather than closing, why don't you reopen those half a dozen units that generated all that profit?
No, Arthur, we will let you speak, but there were people who were there before you. Arthur, there were people here who had their hands up before you.
I've had my hand up.
Arthur, I promise we will.
Let him speak. We're okay.
We will let him speak.
My name is Suzanne Aaron, and I chair the Human Services Committee of Community Board 2. We're Greenwich Village, Soho, NoHo, almost into Chinatown. I have a couple of comments and also an actual process question. One comment is that the fact that in this day and age, this meeting wasn't held as a hybrid meeting, and that there was no way to link into it as a webinar, to me conveys mistrust and a lack of confidence in wanting to actually share this information with a broad community, which breeds mistrust with the population that already doesn't trust you very well. I think that you advertise this poorly, and you could have made this a hybrid meeting and had a lot more participation. The other, I have an ask, which is that this presentation, at least at a minimum, be shared with all the community boards and anyone else who'd like to have it. And then I have some actual process questions. In Greenwich Village, we actually did have a hospital close, as you well know, St. Vincent's, and it was not pretty. We have got an emergency room in its place, and it's lovely, but it is not a level 1 trauma center. And we have a lot of difficulties with interfacility transfers from LHGV to hospitals that are not Northwell. 30% of patients, when LHGV requests transfer to different hospital systems, only 2% of patients are declined at Lenox Hill, but 34% of patients are declined at other hospitals. So there is a limitation to having an emergency room that isn't what BI's emergency room is. And then I have another process question, which is the person who isn't here where is the State Department of Health in all of this? I mean, they're not at this meeting, and they should be at this meeting. But a process question that I can ask all of you is, can you please share with us what conversations have been going on with the state? What kind of data have they requested from you, not to determine whether you guys are hemorrhaging money, which I buy, but what the impact will be on the broader community of your closing? And do you need state approval in order to close? So if you could just at least enlighten us on what the inside story is going on in terms of the process with the state, that would be helpful.
I'll attempt to address the process question. Others may want to add to that. But we had to file what they call a closure plan, which is on our website if you want to access that. It's a 150-page document. It's right here. In here, there is a lot of data about the patients that we serve. With regards to that is included in there. But yes, we need the approval from the Department of Health before the hospital closes.
They're already closing.
I'm sorry. What is the Department of Health requiring in terms of understanding the externalities of your closure?
That's what they require.
They haven't gotten back to them yet.
It's in here, and we've been talking to the Department of Health, for a long time about all of these issues, but they have not yet approved their closure plan or engaged in some specific.
Correct. So why are we closing the hospital before you get approval?
And getting rid of back to your other question about the presentation, if Union Wood 2 wants us to come to make a presentation, we will come to make a presentation to them as well. Okay,
If you haven't gotten approval, why are you shutting
Yeah, correct. The health plan.
Before I launch into my story, there was that last question about the DOH, because oh, I'm sorry. My name is Arthur Schwartz. I am the Democratic District Leader for Greenwich Village and a public interest lawyer and a union lawyer. Before I get into my longer question, that procedure that was just referred to about what the State Department of Health requires in terms of a closure statement, one aspect of that, I think it's paragraph 6 or 7, says no closures within the hospital, no downsizing of services may occur until the final plan is approved. But it's clear, I have been getting letters from staff telling me this is closing, that is closing, this is closing, we're cutting beds, we're cutting services, we're cutting doctors. How is it that you're doing that in the face of the law? That's question number one, and then I want to come back and ask you another question. But since we talked about this closure plan that you have on your website, how is it that you're shutting things down when the DOH regulations say you can't do that?
Very good question.
Yes. Excellent. Yeah, so number one priority for us is
Can't
safety.
hear you.
Number one priority is safety and quality at the hospital.
That's not answering the question.
And we are focused on that, and we are taking action in order to preserve safety and quality.
Oh, come on.
Answer the 11-hour wait for the transfers.
How can you shut down services when the law, the regulations say until the closure is approved, you shall not eliminate services? So you can think about it, because that's going to be the basis of the litigation we start. But I want to pick up on what Mike said. He's like my number one fan. I didn't pay him to say that. And I'm someone who has a long association with the hospital. My first child was born here, and I slept here for the 3 days. We used to let you stay for 3 days. Now you don't stay that long. In 2017, I woke up one morning and I knew I was having a heart attack. I live in the West Village, and I went to the 2 blocks to Northwell, to the Healthplex it was called at the time, and I went in there, and they said, "Oh, you got to go in an ambulance." I get in the ambulance. They say, "We're going to take you to Lenox Hill," and I said, "That's far away, and I'm in the middle of having a heart attack." They said, "Well, we could take you to Beth Israel." I said, "Fine." So I came here, and within 1 hour of when I woke up, I had stents going in my heart, and I had no damage. Zero. I walked out the next day. It was wonderful. But I was ready to walk out the next day, but somebody came by and visited and said, "Oh, that I'd written an article in the local newspaper asking whether Beth Israel was about to shut down," just raising some questions. And so the nurse, I had to go, they decided they want to do another stent the next day. So while I'm lying there on the table, all these nurses are coming and saying, they're doing this, they're doing that, they're going to close this, they're going to close that. They said, you're really lucky that you didn't need heart surgery because they just closed the heart surgery unit last week, and we would have had to ship you up to 96. So we got into looking at all of what was being done. And what was clear in looking at the statistics, I'm not sure that the number Mike gave was exactly right, but you had shut down, that year, you shut down maternity, you shut down neonatal, you shut down pediatric surgery, you shut down heart surgery, which was part of a closure plan, although you didn't totally say that. And every one of those, when we looked at the numbers, were the most profitable centers in the hospital. So then we sued about it, and I'll take some credit. For 2 years, you didn't close anything else down. And then the week before COVID, we got a decision which you guys did not follow. It said that you didn't do a proper CON for the closing of the heart surgery unit. But the decision was March 7th. The city shut down on March 15th. And then we started hearing about aircraft carriers and the Javits Center having beds. And a bunch of us picketed the hospital and said, why aren't the 400 or 500 empty beds in this hospital being used? And then you guys said, okay, we'll open up and allow them to be used for COVID. And for the next 2 years, you guys had hundreds and thousands of COVID patients. And this hospital was buzzing. And during that, and then you announced about a year and a half ago, they weren't going to close. I was talking to your lawyers and they said, you don't have to appeal, we're not closing, we're not moving forward. And during this period of time, why didn't you take as a model adding back those profitable services that you had before you decided to shut this place down? And why don't you think about that as a model now? Because yes, you're hemorrhaging money because you're taking all the profitable services out of the hospital and telling people to go somewhere else. Have you considered that as a plan? Add back a maternity. You know, we have one place, there's only one maternity place to have a baby south of 23rd Street. One place. You have to go all the way down to just out to City Hall. That's it. Otherwise, you got to go uptown to have a baby. If your kid needs to be in neonatal intensive care, you got to go further uptown. Why don't you add those services back? They're money making. Heart surgery is money making. Maternity is money making. Neonatal care is money making. Why don't you do that as a model and expand your services and make some money and deal with your profit problems that you're creating by not providing services outside that come into the ED?
That part.
Any answer?
So, I think you raise a very important point. The problem is that in order for those very high acuity services, you need a strong amount of volume and you need a lot of expertise. We have chosen to create centers of excellence where we can do those things with a high volume and do it with excellent outcomes. And so that has been our strategy. We can't speak to what other systems or other hospitals are doing. But that is what has occurred with at least our health system.
And specifically with cardiac surgery that you talked about, there are thresholds that the state sets that we have to meet in order to maintain your licensure. The volume had diminished, and we were at the cusp of losing that licensure. So it gets back to the issue of volume and quality, and cardiac surgery was a key example where our volume had diminished to a point that we no longer would qualify to have it renewed.
There was one question you didn't answer. If you didn't get approval, why are you closing?
Yeah,
If that's part of the document that you're not supposed to close anything unless you have the approval, then why are the units being closed?
So we have remained in very close contact with the Department of Health about all of these changes that we're going to be implementing. The key issue, the change has been since the time that we filed our original closure plan, the volume has continued to diminish and staff has started to leave, and it becomes a quality issue. And that's really what we're
turned them away.
By design.
Wait a minute. Of course the volume diminished because you got rid of the tele unit. The cath lab services are going... Are you kidding me?
Correct.
This is self-inflicted. You don't have the services because you are expeditiously closing all of this.
Excuse me, Let somebody else speak.
I'm sorry. I'm passionate about this.
Organizer and I'm the vice president.
I'm passionate.
For the RN division at Beth Israel. And I will say that I also have been a customer of that institution. My mother gave birth to my siblings there. I gave birth to my children there. I've worked in that institution for 34 years plus. I am also an 1199 RN division representative. And I will say this, I have sat since 2016. My specialty was maternal child health. I was a labor and delivery nurse, expert for 28 years. I did private teaching, education. We were a STAR program. Mount Sinai took over the facility, immediately ran through the service, and moved it to Mount Sinai West, where it sits today, because they had built a larger unit, and they had complaints from their community up there, and they felt that the best place for our labor and delivery was to move across to Mount Sinai West. They not only moved labor and delivery, they then moved cardiac as a unit to Morningside. Then, not only did they move cardiac to Morningside, currently, let's go to today. What units have closed? When we were announced that this institution was bleeding, we were willing to accept the bleed. Okay, you are going through a hardship, but all of the services that brought money into the institution, we all know that any institution that removes maternal child health is an institution that is planning to close. The reason why is because a birthing mother brings in her children, therefore pediatrics becomes a service. Emergency pediatrics becomes a service. The spouse comes in, the brothers, the sisters, the aunts. Women in birth will bring their families to an institution and therefore propagate and bring in finances. It will not make the institution a millionaire, but it will ensure that it stays open. Okay, the other thing is cardiac. You have a community, a large community that's elderly, a Lower East Side community where we have a high volume of patients who have diabetes, heart disease, respiratory problems, and they are Hispanic, Asian, Black, fundamentally. And if you look at the Department of Health statistics, those are the communities who consistently need care in a hospital such as Beth Israel Medical Center. And by the way, Mount Sinai BI. Our programs for cardiac cath are being moved. If the law says that they should not have moved, well, by the way, we were announced recently that cardiac cath will be taken out and moved to Morningside and Mount Sinai West. Why is that? Now, when you talk about the system is bleeding, you're not talking, interestingly enough, here's the words. The system cannot afford the loss. We understand that the system cannot afford the loss.
The community.
But you're not saying is that Beth Israel alone has lost the funds. What you're saying is the system has lost the funds, and therefore you've chosen this particular institution, because you've been downsizing it since 2016, to complete moving it out so that you can then spare your losses to the system.
Correct.
But the community is part of the services in the system, and you are leaving the largest part of the community uncared for. Hispanics, Blacks, Asians, Indians. This is a melting pot, the Lower East Side, south of Chinatown, Brooklyn, Lower Manhattan, even Midtown use Beth Israel. Yes, there has been a downsizing. I have been watching it for the last 7 years, since 2016. So we know that you have a plan. The plan started with downsizing Beth Israel, but now it is being sacrificed for the cost of the system, not the community. The community deserves more. The community deserves better. And the members here, the people in this community, do not deserve to be lied to. Don't say that we have less services because we don't have the members, the patients are not coming in. What you're not saying is you created a service within the system that moves patients outside of BI to the other institutions. When Beth Israel has beds for patients in the community, they are asked to hold those beds for the other systems so they can move the unwanted patients back to Beth Israel. And I don't speak a lie, I'm telling you the truth. I live in that institution daily with my members. I live in that institution because my children were born there. I live in that institution because I brought my mother in because she used to get her care there. And guess what? They sent her off after a traumatic injury to Morningside. She had a respiratory issue and her ribs were cracked, an elderly woman. They sent her to Morningside and blew her other lung. My mother no longer exists. Let me say this to you. I was in the emergency room. They were going to put a chest tube in her, but because the system decided that this person should not be treated there, she was sent to Morningside to wait 7 hours. 7 hours for care. I was in a trauma room where they were going to put in a chest tube, but instead she waited 7 hours and died 4 days later. Don't tell me that you are taking care of this community. I'm a registered nurse, a healthcare worker dedicated to this community. I have loved that institution from the day I walked in there. And I am still working for the members there. These people deserve more, and they deserve the truth.
Yes.
Go, Sandy.
You go, co-worker.
It's your turn.
Sorry, was there a question?
The question was, how can you close the hospital given the...
I'm an employee of Mount Sinai Beth. I work in social work.
Okay, girl.
I do social work. My name is Whitney. Now, I came in. Y'all can hear me, right?
Yes, we can. Need the mic.
I came in 2016. When I came in, they was moving services out. So I could definitely attest to what everybody is saying. I want to speak about the family part of Beth Israel, because Beth Israel was not only a good institution as far as patients and the doctors, the nurses, and how everyone cared for everyone, but it's also a family. And I currently work there now. I don't understand why you guys haven't got together with these guys down here to figure stuff out. I don't understand that. We found out all about Beth Israel closing through some loop in a hole we wasn't told, which we should have been told up front, and everything should have been transparent, but it wasn't. I have a problem with that too.
6 a.m. email broadcast.
And yes, and also, you know, all this. Matter of fact, how I found out about this meeting was one of my friends that work in Bronx, Lebanon, sent me an email yesterday. Oh, I see that your hospital is having a meeting.
There you go.
What are you talking about?
There you go.
That's how I found out about
Where was
this
the blast
meeting
for
here.
that one?
So we weren't told about that either. But what I have a problem with the fact is that y'all already closed some services, because I work there in the hospital. 8 Silver's closed.
10 Silver
10
Saturday.
Silver's getting ready to go.
7
Silver's getting ready to go.
Wait today.
Cat is getting ready to go.
CCU.
You understand? I work in social work. Huh? CCU. I work in social work, so more than likely we're probably going to be the last ones to go. We mean a lot to this community, because we help people get home care services. If they need to get into a nursing home, go to a SAR, who knows? We might have taken care of somebody in your family. We don't know. You understand what I'm saying? And I just feel that, you know,
Y'all, okay, y'all talking about y'all want to go outpatient and, maybe it's better to go this way instead of having all these inpatient beds. But the thing is that you're stripping the community. There's nothing here. If you get rid of the emergency room or if you diminish down the emergency room where there's not going to be that many ambulances. People always need care. You understand what I'm saying? And I just feel that what y'all are doing is wrong. It just seems like Beth Israel's a sacrificial lamb. Let's build it better somewhere else. Why not build it better right here? Build it better right here on the corner, or wherever else, but build it better right here for this community. This is a big community. You got NYCHA across the street. It's a Stuyvesant town. You have a lot of elderlies that live over there, children. This whole neighborhood is basically residential. Y'all need to think about that instead of just thinking about, where can we get the fastest dollar? People are getting sicker and sicker every day. Everybody needs care. One day you're going to need care. And y'all need to think about that.
Talk about it.
There you go, Love.
Chris.
My name is Simon. I grew up in the Lower East Side.
We can't hear you.
And went to Bedford. My dad had diabetes and went to Bedford. Got good care. Fortunately, not always. But I don't believe your numbers. I would like to take a look at the raw data. Also, I think you guys realize now that the Lower East Side is different. We don't play that. We really do not. So I think you guys are going to have to keep your lawyers on retainer and but it's true what they say about people with disabilities needing proximity to care. I want to tell you that this is going to be a pattern for you guys because you guys are doing something similar at one of the best hospitals for hard of hearing and blind people at New York Pioneer. You guys are systematically dismantling it, and then you're going to close it. There's lawsuits that are happening in a working group that is trying to fight you on that. So this is not the first time, well, I don't know if it's the first time that you guys try to close that group, but it's not going to be the last. And I hope that the city never gives you guys a contract to come and make the hospital better, quote unquote. Maybe we should give Bedford Group back to the community and give it to New York Trucking Hospitals. They'll take care of it like they take care of Bellevue. Because you guys are not going to move the job. Hello, my name is Edward Funches.
Can you get closer to the mic?
Hello, you hear me?
Yes.
My name is Edward Funches. And it's really a shame. Y'all should be ashamed of yourself. Yeah. Like, really so ashamed of yourself. Y'all are all in the medical field. And y'all, we got CEO, wanting to work with y'all, and y'all have not given them no answer at all. Y'all should be ashamed of yourself.
Just before, we're not shutting down the hard aid. It is getting late, so we're probably going to limit to like 3 or 4 more questions. So just letting you know.
Hi there. I live in Stuyvesant town, so I'm right across from Beth Israel. And I want to tell you what I have heard here tonight. I am appalled and disgusted, and you people are ashamed. You're a shame to this world, let alone my community. How dare you do something like this? I mean, I just cannot believe what I am hearing here. It's a disgrace. What I really want to know is, can this hospital be sold to somebody else who would like to run it as the hospital it used to be? Yeah. That's what I want to know. Yeah. Because you people clearly have murdered this facility. Murdered it. Deliberately murdered it. And I think this plan has been a long time coming, which I really did not know before coming here tonight. And shame on all of you. But we demand that this hospital stay open. And we want it to stay open. And all the electeds who are still here, you better damn well make sure that it does stay open. We are not going to take this line down. We are not going to let you to close down one of our only hospitals in this area. And shame on all of you.
Hi everyone, my name is Julie Matos.
Speak up a little bit because you have a mask on.
Hi, my name is Julie Matos. I live downtown. I'm the third generation of Lower East Side. I'm now part of Community Board 2. So I'm glad to see Carlina Rivera was here today. I am really appalling is an understatement because I think that this has been so insulting to everyone. The lack of transparency that we are not getting any answers. Even the state officials, the city officials, asked for answers and all went unanswered or were evaded in some snaky sort of way. And I don't mean that with disrespect, but this disrespect has been to the community. My father died at Beth Israel in a palliative care that was wonderful. I have spent more time in that hospital than anywhere else other than home or job. So I know that triage, the green, the blue, the orange, I know that very, very well. The nurses are exceptional, more than anyone else. But since Mount Sinai took over, I have watched that hospital decline. It got dirtier. The bathrooms were abominable. I mean, the beds. I knew where every linen closet, I know the Linsky Pavilion, the Silver Pavilion, all of them. So this is a big piece of land. So if you are opening, and this, my parents grew up on Rivington Street. This little behavioral center, I'm really happy about it. However, that does not take care of cardiac or strokes or anything or any other health care needs other than behavioral, right? So we're very grateful, but that's like throwing us a little penny. Okay, and I know that there are more projects and low-income housing in this area than probably anywhere else in Manhattan. And so there is Medicaid, and they don't pay as much. You have already cut out United Healthcare Medicaid from all Mount Sinai systems, which no one has mentioned yet at the beginning of this year. I lost my Eurogone because I could not go to, I could no longer see her because I'm United Healthcare. But you have cut out not only services, but you've also cut out medical insurances. So this smells to me like it's more of a money grab than anything else, and we don't have a hospital, the capacity, and I understand. So if it's that big, why can't you condense it? Keep half the building. I don't know. I'm not an architect. But keep half the building and some of the departments, or bring them back, because it is needed. This is needed. While Cornell, New York Presbyterian is where most of my providers are at this point in time, they hold 200 beds at maximum. We know from Cabrini Hospital that had closed and then reopened for the pariahs of the AIDS crises, right, as they were considered. My brother died of AIDS, as did all my friends of that time. So they had to reopen that hospital and shove the unwanted people there. And now the unwanted people are downtowners. Yes, we have Tribeca that's very wealthy, and we have the West Village. But the rest can be low and middle income, and we're just being thrown away and discarded with ill regard, and it is absolutely appalling, disgraceful, and no we still haven't gotten any answers about the state and the boards that are the ones who make the deciding factors. And this, if I did not get an email from an activist friend of mine, I would not be here today. I had no idea, it wasn't announced, and I'm a member of a lot of groups.
Okay, so we do have to wind down, so I'm going to let you give the mic to the gentleman in front of you. If you just give me a second to speak first. This is going to be the last question. Anybody who still has a question, see me afterwards. I will give you my card. You can send me the question, and I will get that taken care of. This is not going to be the last forum. We will work with our elected officials and community groups to be able to open it up to wider audiences to make it more, whether it's, again, part of what tonight was wanting to get out there and get the process started, meeting with people. We will open it up to probably with a virtual aspect of it to make it easier for people to come, especially with the winter coming. So I just want to let you know, this is the last question for tonight. This is not the last question we expect, but as I said, anybody who has another question, I'll give you my card, you can send it to me, and we will try to get you the answer. So, sir, you
Go ahead, Mark, do it.
Hello, everybody. My name is Mark Rubin. I'm a nurse in the intensive care unit at Beth. I've been there since well before Sinai took over, and have been witness to systematic evisceration of that hospital since the day Sinai took over. Every money-making department has been moved out, one after the other, and then hands thrown up saying, but we're not making any money. At the same time, in this hospital that's not needed, we always have 40, 50 people in the emergency room waiting for beds. And we are now in the ICU, due to an artificial cap on the amount of patients that we can take in the ICU, we're now starting to ship patients from our emergency room to other ICUs. And that is not a good way to take care of people. I'm sorry, I'm just very upset and I don't want, but
Take your time, Mark.
yeah, let me, I apologize. It's just infuriating. As I said, I've watched this from the minute Sinai took over, and it's been obvious that it's a deliberate dismantling of this hospital. And it goes on. Today, we just, again, another unit was walked through and told that when that they have to leave, and there's no approval from the state yet. How in the world could you go ahead and close this hospital without state approval? It's obvious that what's trying to happen is you're trying to make it impossible. If the state comes back and says, no, you can't close this hospital, you're going to say, we have no staff. Everybody left. You forced everybody out, and you continue to do it, and it's obscene. And, I live in the West Village. Healthplex is our poor replacement for St. Vincent's that was closed. I never thought that I'd see that repeated again, but we're seeing it happen again. And Healthplex, the patients who can't make it up to Northwell with cardiac arrest, they come to our hospital. Those patients are going to die. They're not going to make it to other hospitals. So, despite and included in the just obscenity of what is happening here, you people have to realize that you have people's lives on your heads. People are going to die because of this decision. And it's unconscionable, and I'll just end it there. I'm sorry, one other point. We were told originally that, we were closing in July 12th, and now nothing is going to be open past February and March. That's what we've been told, February and March. They're closing this before anybody has a chance to do it, and probably before the state gets back and gives their decision. How do you live with yourselves? That's all I have to say. Otherwise, I'm going to get fired. Anybody?
So the closure is July 12th, it's not in March.
All the units are announced for February and March. I have the list. Of every unit that you said is closing in February and March.
People leave, and all
So the ED, we had it on the slide actually. We will have an emergency department, our pediatric emergency and observation unit, and our psychiatric emergency unit through till July 12th, along with a small med-surg unit upstairs.
That's not a hospital.
That's not what that thing says, and
That's what we're
that's where the problem is too, because y'all give it a lot of information.
Look, we appreciate your passion and your concern, and we will have more meetings.
Next meeting.
Tomorrow, we will work with our elected officials and community groups to try to figure out a time that's good and make it more accessible for everybody to try to get it, whether it's virtual or otherwise. Thank you for coming tonight. We appreciate you being here.